Dr. Jane Buckner. I'm the president of the Benaroya Research Institute with Virginia Mason Franciscan Health.
Hi, my name is Amish Dave. I'm a rheumatologist here at Virginia Mason Franciscan Health, and I've worked with Dr. Carlin now as a fellow rheumatologist for the last 6 years.
So as a long-term patient of Dr. Carlin, he's been my doctor since my first diagnosis, and I had the privilege of having him as my doctor continuously for 9 years.
So I've been in private practice and in research, and for 20 some odd years now I've been here at the Virginia Mason Franciscan Healthcare System. The Arthritis Foundation itself is really important in helping people manage their disease and giving them the support that as physicians we may not be able to give. Support groups, exercise classes. The money goes to a great cause. It all goes to patient support.
And the thing that's really impressive about Jeff is how hard he works. Seeing more patients than anyone, but also really giving that 110% in terms of patient care. He's completely dedicated to that care. I know a little bit about that because every now and then when he's gone, I've seen his patients and they absolutely love him, number one, but I know that they've developed this strong bond because they know he's a straight talking doctor who will tell them the truth but always have their back.
So I would say that Dr. Carlin is both tenacious and curious. Dr. Carlin is recognized across the Pacific Northwest as a rheumatologist with a big heart who's taken care of patients from the Aleutian Islands to Guam. Over 40 years, he's taken care of thousands of patients and their family members with all sorts of autoimmune diseases and arthritis.
Thinking about how to best describe him on the way here, and all I can say is he not only treats patients, but he also empowers patients. What I mean by that is that he doesn't just tell you, like, you have to take control of your health, you have to do this, but through the interactions, somehow he made me feel kind of courageous.
When I think about Jeff, I definitely think he is passionate about his work. He is opinionated about what he thinks should happen. And that's been important because he makes things happen for his patients because of that passion that he shows. And he's not quiet about it. That's another important point about Jeff. And when you work with him, you know that too.
After being a patient of his for a few years, I started expecting more from other doctors and other nurses that I had. Every time I had an appointment with him, I came out feeling very motivated and very empowered. Yeah, that's why he's very special to me.
Really important to me is this teamwork, and the conversation between a physician and then a patient, and to be able to negotiate that with the patient and work with them, hold their hand if need be, and get them to a much better place. That's why I do what I do. We have made amazing progress in the years that I have been in clinical practice. Whereas a disease like rheumatoid arthritis, before people were disabled, now I have people running marathons, which is crazy from my perspective, but so gratifying. As far as being honored, I'm really touched. I never expected to be honored in this way. I'm a kind of a modest guy. I just do what I do because I believe in it and I have the passion for it. To be honored by my coworkers, my peers, is very touching to me.